Hi, I'm Dr. Joshua Lewis. I'm an internal medicine specialist and I'm co-founder of MyPreOp. Earlier in our process, we had a different mobile device management company that was very limited, and I think the opportunity cost of using that in the beginning really prevented us from expanding more rapidly.
My name is Dr. Shamim Shakibai. I'm an internal medicine specialist, and I'm the CEO and co-founder of MyPreOp. So before Hexnode, it was a bit cumbersome and time-consuming. We had to kind of tell patients, okay, click here, sign in there, click on this icon, go back. And it almost took as much time as the exam itself. And so patients were getting frustrated and we were getting frustrated with the whole process. And so at that point, we realized that we really needed a better solution.
So we compared a couple of companies that were doing mobile device management, specifically with the ability to have remote control of the devices and remote view of the devices. Hexnode, kind of came out ahead in the end, and we've been very happy with them. So initially we started off with about 5 devices, and the various options out there required minimums of 25 plus, which were for companies that are established and much larger than we were as a startup in the early days. And so Hexnode did have a lower minimum device requirement, which also made Cespress starting out as a startup, really bootstrapping at the beginnings. We are a telemedicine company, and we see patients remotely, and we do a complex type of medical visit, which is required before somebody has surgery, just to make sure that it's safe for them to have surgery. Typically, this kind of a visit needs to be done in person in an office. And what our company does is we use the latest medical devices for use in the home, and we send these to the patient in the mail. And using Hexnode, we're able to have a tablet amongst those devices that is able to tie everything together and allows us as the doctor to walk the patient through the process and make it very user-friendly and really sort of make this process work. And so for us, the mobile device management, secures the device so that when these arrive at the patient's homes, they're not able to watch videos or surf the internet. It's really just restricted to the applications that we use for the in-home diagnostics. And then we're also able to connect to the tablet remotely, so we can see exactly what the patient sees, and we can also control the tablet for them. And so we're able to, have the patient hold the tablet and open up an application, connect the device, record a 12-lead EKG, and listen to their heart and lungs, do all these advanced things without the patient really having to do anything. We're controlling the whole process from where we are. This process has allowed us to become much more efficient, and we can see much more patients, in a day than we could before, and it really just has streamlined everything.
The Hexnode has allowed us to save a significant amount of time on our testing appointments, which has allowed us to be able to book more patients and serve more patients on a daily basis. So from a time perspective, and obviously there's a financial consideration when it comes to time. So I think definitely both time and money have been greatly saved by using Hexnode. The biggest thing about Hexnode that I love is just how easy it is to interact with the software. And also the tech support has been really great. I mean, whenever I've had an issue, I've immediately been able to interact with the tech support person, and they've been very, very helpful. But those are the 2 things that I think I love best about the software. With our patients who are not as tech savvy as most, Hexnode has really been a big difference maker, because we take all of the navigation of apps and clicking and logging in, we take it completely out of their hands. And Hexnode allows us as the providers to drive the whole process. And so it really helps the patients focus on the actual devices and the actual testing itself.
For people who are considering using Hexnode, I would say just jump right in and do it. Do a free trial, work with the staff to set it up and customize it how you want, and you'll quickly realize how powerful it is. This has been so integral and key for us, we wouldn't be able to function without it.